Good afternoon, and for those of you joining us from across the country and around the world, good morning and good evening. Welcome to the fifth and final session of the 2020 NTM and Bronchiectasis Virtual Patient Conference. I am Amy Lietman, Director of Policy and Research for NTM Info and Research, and I will be serving as moderator. On behalf of all of us at NTMIR, thank you for joining us. The topic for today's webinar is coping with chronic illness, and we are delighted to welcome Dr. Kristen Holm as today's featured guest speaker. Dr. Holm is a marriage and family therapist at National Jewish Health in Denver, Colorado, where she is also an associate professor in the Division of Medical, Behavioral, and Community Health. Her research focuses on social and psychological factors that are related to COPD outcomes, including the extent to which the relative importance of various social and psychological factors differ for individuals with COPD due to alpha-1 antitrypsin deficiency. Dr. Holm received her PhD from the University of Minnesota and her MPH from the Colorado School of Public Health. She also completed fellowships at the University of Colorado, Denver, and National Jewish Health. During today's webinar, you may ask questions using the Q&A function on Zoom. Click on the Q&A icon on your screen, type your question into the box, and then click send. At the conclusion of Dr. Holm's presentation, the moderator will read questions from the queue for Dr. Holm to answer. Today's webinar broadcast is being recorded and will be posted online at the conclusion of our seminar series. So if you missed the answer to a question that is asked, you will have the opportunity to hear it again. Our thanks to Insmed, Aflovest, Spiro Therapeutics, Maxor Pharmacies, and Beyond Air. We are so grateful to our sponsors for their support of this program and for all the work they do to develop new therapies to benefit NTM patients. You'll be receiving more information for our virtual exhibit hall, which features these amazing companies and gives you the chance to learn more about them and everything they're working on. You'll be able to read more about their work, view informational videos, and find links to their websites to learn more. At no other time has there been this much interest in and work on NTM and bronchiectasis. This is a very exciting time for all of us, and we encourage you to check all of this out because these companies play an integral role in fighting these diseases, and the work they do directly impacts all of us. You can learn more about NTM Info and Research and sign up for our electronic news at ntminfo.org. And you can also find us on Facebook, Twitter, YouTube, Instagram, and LinkedIn. And now I would like to turn this event over to Dr. Holm. Dr. Holm, welcome, and thank you for being here today.
Thank you for having me. All right. My first goal is to be able to share my screen. Looks like I'm good?
Yes.
Okay, great. So I am delighted to be here virtually today to discuss coping with chronic illness. And my slide advancing isn't working, so let's see. I'm going to have to be flexible here. Let's see. How about that? That worked, didn't it?
We can see them advancing, yes.
All right. All right, rock and roll now. So a little bit of background about myself, although Amy already gave a little background. I'm a family therapist and I'm a researcher. I've been working for the past 15 years at National Jewish Health. So ever since I finished school, I've been at National Jewish Health. And there are many therapists who work in medical settings like myself. There are also therapists who aren't located in a medical setting, but they focus their work on working with individuals and families who are dealing with chronic health conditions. And myself and therapists like me who are working with individuals with chronic health conditions, we focus not just on treating mental health problems. Our work is really much broader in helping people cope with chronic illness, and hence the title of today's talk of coping with chronic illness. Especially when you have a chronic health condition, it can be really useful to meet with a therapist. And therapy would not just necessarily be focused on treating depression or anxiety or other mental health diagnoses. Therapy could really be much broader to help think through adjusting to living with a chronic health condition, and could include focusing on developing additional coping skills and accessing social support. So today's main topics are coping skills, social support, and psychological distress. All right, there we go. Back to advancing slides. So for coping skills, first topic, coping skills. What do I mean by coping skills? I think of coping skills very broadly as anything that you can do to help yourself shift gears, de-stress, or relax. The first major point here is that no one is starting at zero. Everybody already has some coping skills. And the question is, or a key question is, which coping skills work well for you, either now or in the past? There may be coping skills that you've used in the past that have just fallen by the wayside, even though they would still be useful. And so the key is to remember to be intentional about using your coping skills. So having coping skills is not enough. You need to actively and intentionally use your coping skills. You might want to think of it as an ongoing practice. And often when we get busy or stressed, we might use our coping skills less. Frankly, I'm quite guilty of that. Whenever I get stressed and busy, that's really when I tend to feel like I don't have time to do those things that help me to cope with stress and to take care of myself. And really, coping skills aren't a luxury for just when you have lots of time. Really, they're a necessity. And so that's a little different way of thinking about it, as being a necessity rather than a luxury. Another important point is that coping skills are not one size fits all. So what works well for you will be different than what works well for other people. So you have permission to be an individual in terms of figuring out what it is that are your go-to coping skills. And those skills may change over time. So what's really useful to you now might be really different than what was useful to you 20 years ago. Or it may be that there are some things that are steady Eddie coping skills that are really useful to you over a long period of time. So step one is really to make the most of your existing coping skills. Start with what you already have, and then consider whether you need to develop any additional coping skills. And if you decide that it would be worth developing some additional coping skills, start exploring and really keep an open mind about it. There are bullet points on the slide with that looks like kind of a long list. And those are potential coping skills. And really that's just the tip of the iceberg in terms of thinking through what might be useful coping skills to add to your repertoire. And especially I think when you have a chronic health condition, you might have a limited ability to use some of your existing coping skills. So for example, maybe traditionally you've gone jogging as a way of reducing stress, and then fatigue may now get in the way of being able to use that coping skill and gets in the way of being able to go for a jog. So it may be really especially valuable to develop additional coping skills when you have a chronic health condition. And when you develop new coping skills, you could do this on your own, or this is something that you could do working with a therapist. It's handy to have some coping skills that you can use in really short bursts, like 5 minutes or less, and in any location. So breathing techniques are a perfect example of something that you can do anytime, anywhere. So for example, I'm imagining sitting in the waiting room at a doctor's office and starting to feel anxious or worried. You know, having some quick, easy go-to coping skills like breathing techniques that you can use in that type of situation is really useful. Sometimes when I ask people about their coping skills and what helps them to reduce stress, they'll say, oh, I love to travel. I love to go to Hawaii. which is, it's great when you can do it, but it doesn't meet that criteria of anytime, anywhere. Although maybe sitting back and envisioning a sunset you saw in Hawaii or something like that is something that you could call on anytime, anywhere. And coping skills include, there are really two major categories here: activities that you do and ways of thinking about stressful situations. And the ways of thinking coping skills can be harder to identify. So I'll be spending more time talking about those. So one ways of thinking coping skill is to focus on the present and to limit the amount of time that you spend thinking about the future, and also being careful of how you think about the future. So making concrete plans for the future is indeed helpful, but general worrying about the future isn't helpful. So if you have a general fear about the future that keeps going around and around in your head like a broken record, that can really fuel your stress. And so it can be helpful to notice those if that's happening with you. And tell yourself, you know, I think there's a valid concern here that's causing me to worry. And think through, how can I break that down to make a concrete plan or solutions to improve the situation? And the goal is to transform the unhelpful worrying into a productive problem-solving process. Another ways of thinking coping skill is to be aware of your automatic thoughts. So for example, if you get a voicemail message from your doctor asking for a call back, is your automatic thought something along the lines of something is wrong? If so, recognize that that's an automatic thought and that it's not necessarily accurate or based on any information yet. So challenge yourself to think differently about that, and to say something to yourself along the lines of, I don't know if there's something wrong. I'll reserve my conclusions until I can talk with my doctor. So as shown in this illustration, automatic thoughts often are not rational, and they can lead you in a different and unpleasant direction. So you see the tracks diverge. Rational thoughts are leading you to one place, and automatic thoughts are, it's a fork in the road and they're leading you into a different place. So when you have those negative automatic thoughts, catch yourself, stop, think through the situation, and challenge yourself to think about it differently. And that can reduce the stress that comes from jumping to negative conclusions. So another set of coping skills is to lighten your load or simplify your life. And the questions on this slide might help you to do that. As you can see, the key issues are about identifying what is most important to you, learning how to say no to things that are not highly important to you, and prioritizing yourself. And it will take some personal reflection and perhaps some soul searching really to identify what is most important to you. This isn't just about time management, it goes a lot deeper than that. And even when you know what's most important to you, it can be challenging to make changes and structure your life in a way that allows you then to focus on what is most important to you. And you may need to learn some skills in how to say no, because that may not come naturally to you. And it really is kind of a set of skills to be able to say no. So if you need to start saying no and you're really more of a yes person, that may be a challenging change to make. And you may feel uncomfortable as you're trying to make that change. And it's okay to feel that discomfort. You could acknowledge the discomfort as a natural part of change. And it can help to think of these changes as temporary or as an experiment. And that temporary or experimental mindset may help alleviate some of that discomfort. So for example, if you're always asked or expected to run the bake sale every year, and that's something that you need to say no to this year, that doesn't necessarily mean you'll need to say no forever into the future. So you could tell yourself and other people, I need to say no for now, for this year. Another way to lighten your load is to eliminate the emotional burden of guilt that you might experience about living with a chronic health condition, or about the effects of that health condition on your family or other people who are close to you. So I challenge you to think about whether you're being too hard on yourself. If you feel guilty for having a chronic health condition, or for how that health condition is influencing your life or the lives of people who are close to you. If you are feeling guilty or being hard on yourself, you could ask yourself, if I had a friend with this health condition, would I, how would I treat them? How would I think about them? Would I blame them for having the illness or for how they're coping with the illness? Your answer would probably be no. And so hopefully that shift in perspective can help you to be kinder to yourself. So give yourself credit and not guilt, because guilt becomes yet another burden. Another way to cope with chronic illness is to gather information and learn as much as you can, which everyone on this call is probably prone to doing that, because that's part of what drives you to join this lecture series and to join today. But there are some caveats and things to think about when you are information seeking. So if you've ever Googled NTM, you've probably found some incorrect or misleading information. So you've got to consider the source. So one vetted source would be ntminfo.org. Also be aware that there's two basic types of information. One would be factual information that tells us what's known about NTM and what's known about treatment options. And the other type of information is other patients' experiences, including their opinions about what it's like to live with NTM. And you may need to use a filter when you review this information and monitor yourself. Make sure that you're not becoming overwhelmed, and set limits if you notice that you're becoming overwhelmed or upset. Because it's easy to kind of keep going past the point of informing yourself, and really to get to where you're kind of spinning your wheels on at kind of getting overload, information overload. It's also important to recognize the aspects of the situation that are under your control. I'm definitely aware that with a chronic health condition, there's much that feels, and indeed is, out of your control, but not everything. So whenever possible, focus on the controllable rather than uncontrollable aspects of the situation. So it can be useful to try to think through what pieces you have control over. So when you have a chronic health condition, you have at least some degree of control over meeting with your doctors and other members of your medical team. Hopefully you have a fairly high level of control over following through with medical recommendations, and also hopefully a high level of control over actively and intentionally utilizing your coping skills in order to manage stress. And all those activities are really important activities over which you have some element of control. And give yourself credit for the energy and time that you spend on these activities that are under your control. So then a logical next question would be, well, what do you do about the uncontrollable aspects of the situation? Because they certainly do exist. And really the goal here is, as best you can, to manage the emotions that come up. And those emotions are usually challenging and uncomfortable. And so this is easier said than done. But this is where you look for ways to accept or make peace with the situation. A lot of times faith is very useful here. You can distract yourself with activities that make you feel better. I don't recommend that as your sole coping skill, but the distraction element, there is a value in distracting yourself at times to kind of stop a negative train of thoughts and to help yourself shift gears. Another thing to do about the uncontrollable aspects of the situation is talk with other people, seek out that social support. It can be useful to express your emotions and get them out, or in talking to other people, you may wind up focusing on that other person and what's going on with them. And that shift of gears into focusing on someone else can be useful. Another option here is that you can worry at times. So allow yourself to worry on a limited basis. And this might sound strange, but there is, this is something that comes up in therapy, is essentially training in how to worry in an effective way. This often comes up particularly in dealing with insomnia. If someone has insomnia because they can't fall asleep because they're worried, one recommendation for that can be to schedule worry time. And so that worry is kind of accomplished and taken care of earlier in the day before you go to bed. And schedule that worry time not right before you go to bed. Have it be time limited so that it can't go on and on. You may even want to, schedule another activity that would occur after the worry time that would help you shift gears. And then what you do during that worry time matters. So being able to even take pencil and paper to write down what are those concerns or those worries, and to think through what are the aspects of these worry situations where I've got some control. So back to, as we already discussed, that control element, looking at where you've got some degree of control and then making some plans for steps that you're going to take to manage those things that are under your control. So there can be useful ways to worry. So final thoughts on coping skills. Start with what already works for you. You're not starting at zero, so make the most of what you already have. Coping skills are not one size fits all. You're unique in terms of what's going to be useful for you, and how useful a given coping skill is may change over time for you. So if you need to develop additional coping skills, experiment and keep an open mind. And this is something that you could work with a therapist on. So next big topic, social support, which is not really a separate topic from coping skills, because accessing social support is part of the coping process. And when I think about social support, I think the key questions are, do you have enough people in your life? And I think of that in terms of the kind of the full range. Do you have people that you can go through the full range of emotions or experiences with? So from having fun and enjoying life to being sad, and at times mourning what's going on in life. And ideally in your support system, you'll have people who can go to both extremes with you. Do you allow other people to support you? A lot of times people have support that they don't really fully take advantage of, or don't take advantage of at all, because they don't want to allow other people to provide support for them. And ultimately, the question is, do you feel isolated, or do you feel connected? Another important piece about social support is that it is more about quality than quantity. And research has been conducted to even look at this. And the answer is that really it's about quality. So it's not about naming at least 10 people that you can have fun with, and at least 10 people that you can have sad with, or a certain number of people you could call in any given situation. It doesn't need to be a large number of people. Ultimately, if you are someone who really prefers a small, close-knit network, and that network meets your needs, then it meets your needs. So I'm not pushing for necessarily quantity. It's more about quality. So one way to think about being diagnosed with a chronic illness is to think of it like being sent to live in a foreign country, all alone, suddenly, and against your will. And so this is not like that I finally get the chance to move to Tahiti, which I've always wanted to do, but rather that I got sent to some country that I've of that I would never want to go to. And in going to this foreign country, you have to learn a whole new language and culture, like learning about sputum and PICC lines and other things that might be part of your daily vocabulary now that weren't prior to diagnosis. So you've got to learn that whole new language and culture. And then you've got to educate visitors on that new language and culture. And when it comes to educating visitors, who do you want to invite to visit you? When or how soon after diagnosis, and for how long? And you are in control. You don't have to invite everybody to visit you. You don't owe everyone the full and complete details about your health condition. You get to decide how much information about your health condition you want to share and with whom. So you get to choose who you invite to visit. Most likely, though, you'll get really lonely if you don't choose at least a few important people to visit you, or maybe even move there with you to the extent that they can. And so it takes energy to educate visitors, but it's really worth spending the energy to do so. You might need to ask visitors for help sometimes, and it can be hard to ask for help or even to accept help when someone's offering it without you even having to ask. And so remember that relationships are a two-way street, and most likely you have helped people in the past, and now is the time to accept help. And really often it's easier to be a giver than to be a receiver. And I'm aware of that. But it may help to remember that there are probably people in your support system who genuinely want to help. You're not burdening them by accepting their help. This is what they want to do. So are you willing to receive it? And are you comfortable asking for what you want and need? A lot of times friends and family members know that they want to help, but they don't know what's most useful. And so you can help them by having honest conversations about what is most helpful to you personally. It may be that what you would love is for people to bring food occasionally, or maybe that's not at all what you want. Maybe you would like a ride to the doctor. Without thinking that through and knowing what you would like and then communicating that to people, you may get some kind of misdirected help, or some help that isn't as useful as what it could be. Another thing that can happen is role changes in the family due to a health condition. And so once again, communication is key in managing this, and being open about the fact that those changes are happening, that what you may be able to do within the household may change over time based on your health condition or may fluctuate. And so having honest conversations about that can help make that be less of a stressor. And certainly allow yourself to grieve if there are things that you used to be able to do, that you either enjoyed doing or valued doing, and that you can no longer do. That is a loss. And that is important to recognize those losses. At the same time, though, hopefully don't focus exclusively on the losses. Be able to recognize the things that you still can do, and the roles that you still do feel. And also, it's not necessarily negative for other family members to take on some new roles. So I'm thinking especially of kids as they get older, having them take over some more roles in the household is actually really good for them to be able to do. Roles do tie into identity and self-worth. They're really not just about what you do, but how you think of yourself or who you are. Almost like this idea of, I keep our house clean, therefore I'm a valuable person. And hopefully seeing it in that way can help to challenge those beliefs a little. Hopefully I'm a valuable person, even if I'm not able to keep our house clean in the future, or keep it as clean as I have in the past. That I still have value as a person beyond the house cleaningness, behind the house cleaning that I do. So if your roles and identity are changing, make sure that you still look for those positive aspects of yourself. And remember, there are a lot of important ways that you can contribute to your family and to society. And now we're to my third major topic, psychological distress. Sometimes, even with excellent coping skills and great social support, you're probably going to feel upset or worried. You may be doing okay with your existing set of stressors until one more stressor happens to you, like the straw that broke the camel's back. And so a key question is, how can you distinguish normal fluctuations in mood from clinical depression or anxiety? And this can be really difficult, especially since we often talk about feeling depressed or anxious in our daily lives. So this slide lists symptoms of depression. The top two bullet points that are in italics and underlined are key features of depression, and you have to experience at least one of these symptoms in order to meet criteria for a clinical depression diagnosis. Note that this first symptom includes some information about time. It says depressed mood most of the day, nearly every day, and the full criteria also specify that this needs to happen for at least 2 weeks. So it's depressed mood most of the day, nearly every day, for at least 2 weeks. So if you have a bad day every once in a while, or if you feel sad for a short period of time in the course of a day, that sounds more like a normal fluctuation in mood rather than this most of the day, nearly every day for at least 2 weeks type criteria. A note about this second symptom that's listed, diminished interest or pleasure in activities. This means that you don't enjoy activities that you are physically capable of doing. So if jogging is no longer pleasurable to you, and it's due to changes in your physical health condition, that wouldn't count for this symptom. It would be more like saying, I always loved watching Pee-wee's Big Adventure. That movie just cracks me up. But lately, that it doesn't bring me any happiness anymore. That would be an example of meeting that criterion. Also notice that fatigue is that third symptom. Fatigue could also be caused by NTM or by your medications prescribed to treat NTM. So you can't use this list to diagnose yourself. Please do not use this list to diagnose yourself. You would need to work with a physician or a therapist to discuss your symptoms and determine whether you're experiencing a clinical episode of depression. This slide is listing the symptoms of anxiety. Again, these top two bullet points that are in italics and underlined are key features of anxiety. Once again, we've got some information about time. So it's experiencing the anxiety and worry for at least 6 months. I'll point out that that second bullet, difficulty controlling the anxiety, can be hard to define. And fatigue is listed again. So it shows up again. So more on that in a moment. The symptoms on those slides don't count toward a depression or anxiety diagnosis. If you are experiencing those symptoms due to your medical condition or medications you're taking to treat your medical condition. So back to that fatigue example, it can be a symptom of NTM, symptom of depression, symptom of anxiety, side effect of medications. So if you experience fatigue, it can be difficult to determine whether that fatigue is due to NTM, medications, depression, anxiety, or really a combination. So diagnosing depression and anxiety can be complex, especially when you have a chronic health condition. So work with a physician or a therapist to discuss your symptoms and determine whether your experiences seem to fall into that category of clinical depression or clinical anxiety. Back to this idea of distinguishing between normal fluctuations in mood and clinical depression or anxiety. One kind of unofficial way of thinking about it is you can go there, just don't park there. Again, that phrasing is back to that idea that it's normal to feel depressed or anxious at times, but you don't want to get stuck. And so how do you know when your symptoms are beyond what is normal? Stuckness is a big indicator. So if you feel stuck, that's definitely an indicator. Another thing to think about is interference. If your symptoms interfere with work, activities, relationships, or sleep, if those symptoms on the slide, if those symptoms are interfering, that would be a key sign that this may indeed be clinical depression or clinical anxiety. So if you're experiencing that interference with your life, it's time to seek help. When in doubt, go ahead and seek evaluation and or treatment to get help with those symptoms. So treatment is always an option, and this slide shows in pictures the two main methods of treating depression and or anxiety, medications and talk therapy. It is interesting to note that the pills look so very happy and the therapist looks really a bit worried. So in the future, I might need to find a different picture that paints the therapy side in a little better light. But medications and therapy are both options for treatment. For mild to moderate depression and anxiety, medications are effective, therapy is effective, and on average, just averaged across populations of people, the medications and the talk therapy are equally effective. Once you get into severe depression or anxiety, medication is more effective than the talk therapy. However, there is no reason on earth why you would need to do only one or the other of meds or talk therapy. And in fact, research shows that the most effective approach is to deal with depression or anxiety from both treatment angles. So medication and psychotherapy together, they each contribute something a little different and lead to the best results. In terms of quicker results, medication usually is a little bit quicker than talk therapy, but talk therapy is more effective than medication at preventing relapse over the long haul, which makes sense if you think about therapy as a way of learning skills and ways of thinking that that if you're implementing those over the long haul throughout your life, those are skills that you have next time you experience a bout of depression or anxiety or have another very stressful life event. So obviously this would be a very boring slide for me to just read out, but what this shows is these are different professional societies. The top 3 are focused on talk therapy. The bottom one for the American Psychiatric Association, that's how you could reach out and find a psychiatrist. That would be a physician who would be more focused typically on prescribing medication than on the talk therapy piece. And as Amy mentioned, these slides will be available later if you wanted to come back and look for any of these. But for all of the websites, you can go in and find a place where you'll find a link that's something along the lines of search for a therapist. And you can look, most or all of these places, you can look within a certain distance from your zip code. So you can plug in your zip code, and if you live in a major metropolitan area, you could look within 5 or 10 miles. And if you need to, you can expand that search to 30 or 60 miles or farther in order to find information about a therapist that you could work with. So I've got some advice on like tips for finding a therapist. Don't get stuck on the exact credentials, but you do want someone who is licensed. So for talk therapists, there will be a variety of degrees or letters after someone's name. Someone might be an MSW, some might have PhD, some might have PsyD after their name, but all states license mental health professionals, and you would want someone who has achieved those qualifications to get licensed in the state in which you live. So the licensing is something to look out for. Ideally, if you have the luxury of having enough therapists within a reasonable distance from you, you would want someone who's got some experience working with individuals and families regarding chronic health conditions, if your health condition is what you feel is a major element of what's driving you to seek therapy. And then ultimately, an important question is, do you feel comfortable with this therapist? If you've met with a therapist a couple of times, at least 2-3 times, and they just don't feel right for you, they may not be right for you. And so, ideally you would go see someone more than once, give them more than one shot. But if you've met with somebody a few times and they don't feel like the right fit for you, they may not be the right fit for you. And it may be that a different therapist would be a better fit for you and a much more effective experience. Not all therapy is the same. Couple family therapy might be a good fit if what you're struggling with is changes in relationship dynamics. whereas this cognitive behavior therapy, or CBT, is not going to get at relational dynamics. It's more individually based. There's a lot of research that indicates that CBT is very effective at treating symptoms of depression and treating symptoms of anxiety. And see some nice things about CBT, in addition to that research base showing its effectiveness, is that it is usually time limited. So it would be a specified course of 12 to 20 sessions. It wouldn't be something that you would, where the plan is that you're going to go once a week for the rest of your life. It would be time limited, and it would be structured and really focused on learning and practicing some specific coping skills. So this slide I've listed just a few self-help books that are based on that CBT. If you were to go to Barnes and Noble or a local bookstore and go to the self-help aisles, probably a large percentage of the books you would find there would be based on CBT. As you can see, they often have a workbook. They tend to have workbook in the title. And so if you're curious to learn a little more about CBT, but not necessarily sure that you're committed to meeting with a therapist, I think of these books as a way of kind of dipping your foot in the water and getting a better sense for what CBT involves. But ideally, you would not solely do a workbook. If you were able to find a therapist to work with, that would be more effective than just you in a workbook. So this is the last slide that summarizes all my thoughts in just a few bullet points. So for coping skills, again, that reminder to make the most of your existing coping skills. It's not enough to have them. You've got to be intentional about using them, and also be flexible and have an open mind about developing additional coping skills. And you might want to think of it as an experiment to see what else works for you. For social support, it will take energy to educate people about your experience with NTM, but it's worth it. And the goal is to feel connected rather than isolated. And in terms of symptoms of depression and anxiety, medications are useful, and talk therapy is useful. And talk therapy can kind of tie all this together and address the coping skills and help you think through how to access social support. And that is all that I've got pre-planned.
Thank you, Dr. Holm. We have some questions in the queue, and before I get to those, I just want to remind people, there were some questions that were asked that were not specifically related to this topic. So we've made note of those questions. We will forward them to the appropriate experts and get those answers. We will be putting the Q&As up on our website to form a question and answer bank. So now that we've gotten that, let me get to the first question. What medication would you recommend to help relax and sleep for someone with MAC? This particular person is asking about cavitary MAC, but I think any kind of MAC lung disease.
Yeah, and unfortunately, the real quick answer to that question is that is outside, like specific medications are outside the realm of my expertise. So I would, as much as I would love to provide guidance, I would be remiss in doing so. So I'm a PhD doctor, and I do the talk therapy piece, and I'm not able to prescribe. So in terms of medication questions, that would need to go to a physician.
So if they wanted to know more about what they, what a physician might recommend, they should talk to their physician.
Yeah, talk to your physician in terms of medications for sleep. I think sleep was built into the question there. So beyond the medication piece, again, back to that idea of depression and anxiety, we could also think in terms of sleep. That in terms of improving sleep, there are probably medications that improve sleep, and also there are probably there are skills, coping skills that could potentially improve sleep as well. And so there's a behavioral angle as well. And in fact, if for anyone who lives in an area where they can find such a specialist, that behavioral sleep medicine is an entire field of medicine. And so there are people who specialize in behavioral approaches to improving sleep as well. So.
Great, thank you. So somebody had asked how they find a therapist who deals with chronic illness in their area, and you had put up some resources for finding therapists. And we're going to put that information, by the way, I noted down that information. We're going to add it to our website. We're not going to wait for the video and slides to be posted. We're actually going to post that particular information on our website, so it's available for patients, and we will make sure we post it on our social media as well, so that patients can have access to that information as soon as possible. But is there anything in particular that patients maybe should be looking for when they're looking at a therapist for coping with chronic illness?
Yes, and actually I can expand on that slide. I can do better than what's just on there. So unless they've revamped their website since the last time I looked, I know that the CBT, the one that, all right, let's see if I can quickly find it. It is the first one, the first bullet point, the Association for Behavioral and Cognitive Therapies. It's the abct.org. Within there, it was set up so that you could, one of the things that was like right on a easy to find page was therapists who specialize in CBT for treating chronic health conditions. And so there are therapists who really do advertise themselves that way. And that's kind of a special, dealing with chronic health conditions is kind of a field within mental health providers. So that should make it a little easier to find people. Also, when you go to those websites and you search for a therapist within 10 miles from your house, most of the websites, like I know that the one at aamft.org, when it shows you your list of results, you don't just get a name and phone number. What you'll get like a bio for the therapist, and that really helps you not waste your time calling people who don't focus on concerns that are your concerns. And so you can read through those bios, and hopefully there will be someone close by you who says, I specialize in working with people who have chronic health conditions. And so that way you know who to call. Also, if you're lucky in where you get your medical care, you may be able to meet with a therapist who's embedded within the team, and who works at the medical center and provides therapy. And in those cases, that would be someone who specializes in working with people with chronic health conditions. So hopefully through one or a few of those resources, it should hopefully be not too hard to find a therapist who identifies themselves as somebody who really focuses on chronic health conditions.
Okay, Thank you. Somebody had a question mentioning a specific coping skill when you talked about taking a long bath. I guess with specific regards to water exposure, they were saying, shouldn't we prefer showers? Um, I know that there's a lot of there's some difference of opinion on that, but I think a lot of
That
people
is a
try to
great
avoid
point.
showers.
That is a great point. And again, so yes, being an informed individual and knowing what works for you, both kind of emotionally and physically, that is an excellent point. So, so for people on this call, if taking a bath and taking a long hot bath is not something you should be doing, strike that off the list of things that you're going to consider. Absolutely, you're empowered. That is a perfect point to say, okay, that one's not for me. That one's a bad idea for me. That's fine. Look for something else. Look for something else that might be a go-to for you.
And having said that, I know that from the sessions I've attended, for example, with with National Jewish and other experts, when they talk about showers versus bath, they say showers will aerosolize more, and with a bath, it shouldn't have like a bubbler. It shouldn't be like a hot tub or a jacuzzi bath. And then if you're worried about the steam, don't make it too hot a bath, and maybe not throw a fizzy bath bomb in there. I don't know. And one of the pieces of advice I've been hearing more and more lately is when you're bathing, make sure your bathroom is well ventilated. So those are the kinds of things that have been discussed when it comes to bathing. So yeah, and part of it is a matter of preference.
Yeah, but also, being an intelligent consumer of everything you hear. So I appreciate having that pointed out. It's a point well taken.
Yeah, and somebody is asking now about your physician calling you. They're saying if your doctor doesn't usually call, is it not unreasonable to think that there is something wrong? And then what do we do?
So, I mean, it's not, that is probably not unreasonable. It is certainly possible and maybe even likely that it may be bad news, but in the absence of certainty, you do not know for certain why they're calling until you talk to them. So to at least allow for for that alternative viewpoint, and be aware that there's still an assumption in there if you assume for sure that it's bad news. And until you talk to them, try to reserve judgment as best possible, until you know what's really going on.
Somebody's asking, most people have too little time, but some of us with chronic disease have too much time given the limitations that our disease causes. Can you maybe comment on how to manage with what people might feel if they find themselves with just too much time to think and ruminate about everything that's happening?
Yeah, that's a really good question. Too much time. And so it's even if time isn't something that is a shortage for you, it is still important to be thoughtful about how you use your time, and watch how your choices about how you use your time affect your emotions. So easy example would be, and I can use myself as an example, watching too much TV right now and letting myself do that, or doom scrolling on my phone. It's not a good, it takes me to a dark place. That's not the wisest thing to do with my time. And so, you've still got to be kind of a, I don't know, a good consumer, or good about how you use your time. So not letting yourself do those while away the time with activities that have a negative impact on your emotions. So challenging yourself to shift gears then. Instead of turning on the TV, pick up a book or do a puzzle, or, even especially with COVID, yeah, we've got a more limited range than ever in what are the things that we can do to distract and use our time and engage. And that's very true. But think through, what are the options available to me? Do I want to pick up, can I pick up the phone and call someone? Who would I call? Puzzles, books, or what you watch on TV, to have it be the Hallmark channel rather than a news channel, or so being thoughtful about how you spend that time.
Okay, thank you. Somebody has asked, chronic illnesses can foster feelings of why me? How do you not overstay your welcome as you host your own pity party?
Yeah, that's a good question. So that fits into those the ways of thinking, coping skills. And you may kind of treat that in a certain way, the same as in some ways, similar to the idea of kind of endless worry. You may want to, it may be useful to allow yourself to have temporary pity parties. I've actually talked with patients who have done that in some effective ways, where they say, these feelings are there. I can't ignore them. They're not going to go away. Shoving them under the rug isn't going to get rid of them. So like allowing room for those feelings in a way that they don't take up too much room. And so I have talked to people who set time for a pity party. They have their pity party. They feel bad for themselves and why me. And at a certain time, it's time to move on. Do something else, shift gears. You've had the pity party, now what? And so that could be an option, because I think it is all a balance of like, I don't want to espouse denial. So their losses are genuine. Having a chronic health condition is hard. And that's legitimate. And that idea of, you can feel sad it is okay to feel sad sometimes. It is okay to feel anxious sometimes. It is okay to feel like, why me? This is unfair sometimes. But setting a limit on how much you allow yourself to feel that way and go there. You can go there, but then find a way to shift gears and move on.
Somebody has asking, they want to know your thoughts about using medicines to deal with anxiety or fear. They're asking about both prescribed medicines and also on using medical marijuana and CBD and the like to cope with anxiety or fear. What are your thoughts on those things?
I honestly, I do not know. I don't know research on the medical marijuana and CBD. So I think that kind of pitching that back to a physician, someone who prescribes medications, is going to be more in the know about how the utility of substances, whether they are prescribed or not prescribed. Certainly, my thoughts on using prescribed medications for anxiety is that I am pro doing so. That it's back to that idea that medications are useful and therapy is useful. They both have utility. They are both resources, and sometimes the best thing to do is getting every resource on board that you can to help you. So prescribed medications are a resource and therapy is a resource. So those are both very good, valid resources.
Thank you. So somebody's asking about, they're asking, do you have any suggestions on getting over their hesitancy to perhaps go on vacation or stay overnight with family and friends because they deal with the embarrassment of the sounds they're making during airway clearance or coughing, bringing up mucus in the morning and after eating?
So for that one, that to me, that goes back to the communication piece. So if your hesitancy is related to your embarrassment about aspects of your health condition and treatments for your health condition, and that if that's where the hesitancy is coming from, what's worth thinking through is, it's great to be able to put a finger on, here's what the hesitancy is. It sounds like this person has already done a good job of being able to pinpoint where the discomfort comes from. And then what can you do about that discomfort? These people that you're thinking of visiting, how would you go about talking with them about this? Would you want to talk about that ahead of time, perhaps before you go, and have some conversations so that they know what to expect, and you can hear them respond to that and say, well, that won't bother me at all, or whatever, and that you can maybe problem solve how best to do it within that person's house, where you can do those things, where you would be least likely to be heard. So communication and problem solving.
Thank you. So how should I get my therapist I currently have to understand the loss I feel since having a lobectomy along with the other complications? The surgeon feels that I may be suffering from what he calls post-surgical depression and loss.
That's a good question and a tough question. One thing to consider is, so already there were two professionals mentioned there. The surgeon has one opinion and the therapist may have a different opinion, and signing consent, you would need to sign consent forms so that they're able to communicate with each other. But it sounds like getting the two professionals communicating with each other, if at all possible, could be useful in changing that dynamic. So that could be one angle.
Okay. Here's a great question. So as not to be confined by geographic locations, do most therapists these days do telemedicine appointments?
So my answer is going to be a guess. Absolutely, there's more and more and more telehealth, for sure. What percentage of therapists and whether that differs by area, I don't know. But I do think that there should be more. I expect that there will be more and more therapists who are doing telehealth. Like, I absolutely expect that it's still limited by state lines, because licenses are state specific. And so typically a therapist would only be licensed in the state in which they live. There may be instances in which someone has licenses in multiple states, but so that it, there's still that limitation by state lines. But actually, I mean, the psychologists are working to overcome that for telehealth, and that's something that's on the horizon to try to eliminate that barrier. So that I think that issue should be improving and improving over time, and hopefully in the near future.
So we've had a couple of questions to ask about social activities and level of comfort. So there are some people who are, they used to go to these activities. Now they're hesitant because of their illness, because having NTM, and they want to know what's the best way to deal with that hesitancy. What's the best way to explain to people what their condition is and what their concerns are?
Yeah, so if the piece about explaining to other people is truly a nuanced answer, because so that it depends. Who are these other people? How close are they to you? And so those would be the things to think through. Is your own comfort level with any given person, how much or how little are you okay sharing with them? And then kind of figuring out the best way, how would you could think ahead of time about how you want to bring it up, knowing what your main points are, so that you're clear on what you want to say, and thinking about it. It kind of gets, to me, this taps into some of that idea of how much information to whom do you want to share? And then once you know that you do want to share information with certain people, being clear within yourself first about what it is that you want to say, so that when you bring up that conversation, if it's hard for you, if you've thought through ahead of time what you want, what your main points are, that will hopefully facilitate being able to say what you want to say. So
has COVID greatly impacted the advice you're giving? Like, has it changed it a lot, or is it still just as relevant, maybe just a little more amplified?
yeah, I mean, I think that the thing, I think that the things that I've said are still true even within COVID. Although it, kind of feels foolish to say as if COVID doesn't change things, because COVID has certainly upended, I think, everyone's life, and different people in different ways. But ultimately, the idea, so the basics of thinking through what are my coping skills, being intentional about using your coping skills, which coping skills are available to you right now are probably limited due to COVID. So, which coping skills are still available to you and safe within the context of COVID. For social support, ultimately the goal is still maintaining connection, but the way you go about maintaining that connection probably has been influenced for sure by COVID. It's a less face-to-face ways of maintaining the connection. So shifting how you go about it. So having the same goals, but you may need to accomplish them differently. And that may be hard to figure out how to accomplish things differently within the context of COVID.
Thank you. We have time for one more question, and I'm going to just group a couple of questions together that are centered around asking for help from others. One person talked about the fact that people are very eager to help at first, but then after a while, because this is such a long treatment process, they get a little fatigued sometimes dealing with it. And then some patients don't have they don't have family and friends nearby. Some people, they're not believed as much, because if you look at some of these patients, they look very well. They're not, but they look fine. And it's one of the things about this illness is that it can be a hidden illness.
Absolutely, right.
What advice do you have for these patients in terms of coping and maybe trying to manage in terms of getting some of the help that they need?
Yeah. So one thought is sources of help, and if possible, that there might be value in expanding sources of help. So for example, support groups, which especially now, but even before COVID, may have been primarily virtual, which I'm pretty sure that your organization does indeed put out information about support groups, right?
Yes, we do. And we're also hosting online support groups now.
Yes, right. So, it is quite likely that there's going to be a different level of a different type of support and understanding that you can get from somebody else who also has NTM, as compared to somebody in your typical social system who may well have a hard time understanding your experiences, especially with this hidden illness. So So the idea of kind of getting different types of support from different people in your system, and expand as needed to get additional types of support that aren't, that you may not be able to get from people who are already in your system. So that's definitely extremely valuable.
Thank you. Thank you so much. We know we still have some questions in the queue, so we are actually noting all of those questions. We will get some answers, and we are, as I said, going to start building a question and answer bank on our website. So as those start going up, we will start notifying you that they are going up. We've had a lot of questions from the 5 sessions, so please be patient with us for a week or two as we start sending those out and getting those answers back. And we will definitely let everybody know once they start going up. But again, on behalf of NTM Info and Research, I want to thank everybody for joining us. We're really delighted that you joined us for these sessions, and we're looking forward to seeing everybody again soon for more virtual programming. And we'd like to thank our sponsors again, and we'd like to thank Dr. Holm for her wonderful presentation and her valuable insights. And thank you for taking the time to be with us today. Thanks, everybody. Thank you so much, and have a wonderful weekend, everybody.